Hey guys, welcome back to the Stress-Free NP. Today we're going to break down questions in pharmacology into their simple forms to help you dissect a question. Even if you don't know the answer, I'm going to teach you tips on how to find the best answer. So let's get at it. Hey guys, welcome back to our pharmacology series. So we're going to go through some questions, we're going to dissect them, we're going to go through the answers, and I'm going to help you, I'm going to teach you some tricks of how to answer questions even if you don't know what the question is asking or the medication in the question. So I have some questions here. So let's start with the first one. So a patient requires a high dose of a new antihypertensive medication because the new medication has a significant first pass effect. What does this mean? Okay, so in this question, this is a very easy question if you know what the first pass effect is. Now, the first pass effect, if you don't know, is a medication taken orally or PO, it passes through the liver, and that decreases the effectiveness of the medication. That's called the first pass effect. So let's go through the answers. So A, the medication must pass through the patient's bloodstream several times to generate a therapeutic effect. B, the medication passes through the renal tubules and is excreted in large amounts. C, the medication is extensively metabolized in the patient's liver. And D, the medication is ineffective following the first dose and increasingly effective with each subsequent dose. All right, so obviously we can figure out the answer is C, the medication is extensively metabolized in the patient's liver, if we know what first pass is. Now, if you don't know what first pass is, let's see if we can dissect this question to at least eliminate two of the answers. So A, the medication must pass through the patient's bloodstream several times to generate a therapeutic effect. Now, just the answer itself, several times it has to pass through the bloodstream to reach your therapeutic effect. First of all, that's not really how medications work. Even if you don't know that, just by the fact that it's saying several times to generate a therapeutic effect and first pass effect is the first time it's passing through, you can kind of say that it's probably not the right answer. So I think we can easily eliminate A. B, the medication passes through the renal tubules and is excreted in large amounts. Okay, so a lot of medications are transferred through the renal tubules, and most of them are if they're renally excreted through the kidneys. It's still not indicative of what first pass means. First pass, if you never even heard of first pass before, you think first pass, it's going to pass by it the first time. So you're thinking of something in the body that the medication's passing by for the first time. We're not really talking about excretion or anything like that. So, you can kind of say that's probably not the right answer. The medication is extensively metabolized in the patient's liver. Now, this answer, obviously we know it's the right answer. So let's skip that one for now. Let's go to D. The medication is ineffective following the first dose and increasingly effective each subsequent dose. Now, that if you don't know what first pass is, you might think that's the right answer. So that answer is worded in a way where it's saying it has first dose in it. So you have first dose, first pass, and increasing effective with subsequent doses. So in this question, A and B, I think we can eliminate, and now you have C and D. So now you eliminated 50% of the question, and now you have an increasingly 50% chance of getting the right answer, either C or D. Again, if you know what first pass means, the answer is easy. If you don't, that's a way to break down that question. Let's go to the next question. You are preparing your morning medications. The patient says, I have had loose stools all night long. Your patient has scheduled glucosate sodium at 9 o'clock. What is the priority action? So this is a very common thing you're going to find in the hospital, and a thing as a nurse practitioner and as a hospitalist, we get quite often that the patient is having loose stools. Loose stools can come from anywhere. It can be infectious. It can be from the food. The patients are eating this hospital food that they never eaten before. Besides that, if you know what ducosate sodium is, which is cholase, which is a stool softener, then the answer is easy. If you don't, let's go through the answers. A, hold the medication and inform the healthcare provider. Now, holding the medication and informing the healthcare provider is probably one of the more common correct answers when you're talking about a side effect or a nursing consideration for a medication. Now, if you know this is a stool softener and the patient's having diarrhea, yes, you're going to hold the medication. And when a patient has diarrhea, you're always going to let the healthcare provider know. B, administer the medication as ordered. So if you don't know what ducosate sodium is and the patient's having diarrhea, the patient's having something that they haven't had before, and you don't know what the medication that you're administering is, giving it anyway, it especially when you have a double negative here. Now you have a negative of diarrhea and you have a medication that you're giving. You have no idea that this medication is a stool softener. So I think that we can kind of put that on the back burner of giving the medication anyway because we don't know what it is and the patient's having diarrhea. Who cares? So B, I think we can kind of eliminate and put on the back burner. C, increase IV flow rate. Now, this answer is weird because duclosate is it's a PO or oral medication. Now, again, if you don't know that, and you have no idea what duclosate is, then that you're not going to know if it's an IV or PO. Regardless, you're never going to increase an IV flow rate of anything on your own. You're going to call the healthcare provider and they're going to tell you you need to increase it or decrease it. So that question is stupid. We can take it out. So now we eliminated B and we eliminated C. So now let's go to D. Ask the healthcare provider to increase the dose of the medication. So say you don't know what duclosate is. Say maybe it's an anti-diarrhea medication and you think, oh, maybe, and you're getting it mixed up with like an Imodium or something like that. So now we have A and D. So now we eliminated two questions. We eliminated B and C, administer the medication as ordered. It's usually never the answer. You never just give the medication anyway. And increase the IV flow rate, like I said, in this question, we don't know if it's a PO or IV medication, but you're never going to actively, individually increase any medication on your own without talking to the healthcare provider first. So in this question, we can narrow it down to two, and now you have a 50-50 shot of answering the question of the medication. And D, honestly, in regular practice is not wrong because you're going to call the healthcare provider up and be like, hey, this patient's having diarrhea, with their duclosate, can you increase it? They're going to be a little confused, but at least they can guide you in the right direction. Like, hey, it's a stool softener. No, we're just going to hold the medication. So either of those questions in real life is correct. But on a test, obviously, you want to hold the medication because the patient's having diarrhea and they shouldn't get a stool softener. So let's do the next next question. So the nurse will be administering an antitussive medication containing codeine to a patient. What is the priority assessment? So this is an assessment question, and you're going to do a lot of assessments before giving medications, whether it's a blood pressure medication, an antitussive, any type of medications. So if you don't know what antitussive is anti-cough. If you don't know what that is, it's fine. You honestly don't even know. You don't even need to know what an antitussive medication is to answer this question. But you need to know what codeine is. Codeine is a very, very common narcotic that we use, and we do use it as an antitussive in a combination antitussive medication or anti-cough medication in the hospital setting and the outpatient setting as well. But this is an assessment question of giving a patient medication at the bedside. So let's stick to the hospital. So let's go to A. A is pulse oximeter reading. So pulse oximeter reading, if the patient's desatting or anything, you don't want to give her narcotic. So we can keep A for now. Is it the right answer? I don't know. We'll go through the rest of them, but it's definitely part of it. So any kind of narcotic, codeine, oxycodone, morphine, whatever narcotic you're giving, your respiratory and your blood pressure are the two different assessments that you're going to want to know. You don't want to give a narcotic if the blood pressure is low, and you don't want to give a narcotic if the patient's respiratory rate is low or their pulse oximeter is low and they're not on oxygen already. So let's go through it. So B is lung sounds. Who cares? Who cares about lung sounds when you're giving an anti-cough medication? The question really here is seeing if you know the proper assessment for giving a narcotic, and that narcotic is codeine. C is respiratory rate. When you're giving a narcotic, respiratory rate is probably the number one thing that you're going to want to assess next to blood pressure. Okay, pulse oximeter readings. Who cares? If the respiratory rate is fine and you place the patient on oxygen, you can still give the narcotic. So respiratory rate is the first thing that you're going to want to assess when giving a narcotic. D is sputum consistency. Who gives a shit? You're giving an anti-cough medication, so therefore, the sputum consistency is, in this question, it's not relevant, because, like I said, this is just asking for your assessment for a narcotic. So now we have pulse oximeter reading and we have respiratory rate. B and D, lung sounds and sputum consistency, we kind of throw out. It doesn't matter. The answer is respiratory rate, because that's the number one assessment that you're going to do next to blood pressure when you're giving a narcotic medication. So in this question, again, we can eliminate two. We can take the two answers that might be correct and just take the more correct one, which is respiratory rate. So let's go through another one. Okay, so the patient is about to receive a morning dose of digoxin and has an apical pulse of 53 beats per minute. Which of the following actions should the nurse do first? Now, this is a very common way a question is worded. What do you do first when you have this type of finding? So, as a nurse, and if you're giving medications, you should already know that 53 is a low heart rate and, bradycardic, 60 to 100 is a normal heart rate. So 53 is obviously lower than that. If you don't know what digoxin is and you don't know that digoxin actually lowers heart rate, then you're not going to know that you should hold the medication and call the healthcare provider. So let's break this down and go through it. So A is hold the dose. That's the right answer. Hold the dose, call the healthcare provider, let them know, hey, the patient's bradycardic, he's due for his digoxin. I held the dose. What do you want me to do? B, administer the dose as scheduled. You have an abnormal finding on this patient. Okay, you have a bradycardic patient at 53. 53, my threshold for bradycardia, 50s to 60s is okay. Anything below 50s is not okay, but 53 is still pretty low. And anytime you have an abnormal finding, especially when the patient has been bradycardic before, you should not just give the medication anyway, especially if you don't know what the medication you're giving is. Call the healthcare provider, get clarification of what you should do. C. So B we can throw out. C. Notify the charge nurse of the finding. It's important to use your colleagues as resources. The charge nurse is definitely a great resource. They're the most experienced nurses on the floor. So that would be a good answer, to notify the charge nurse of the findings. Really, the charge nurse, will tell you, hey, you're bradycardic, don't give the medication and call the healthcare provider. The first thing you should do before calling the charge nurse is call the healthcare provider. And D, contact the provider for dose adjustment. That is a correct answer, but it's not the first thing that you're going to do. So B and C, administer the dose as scheduled. Like I said, you don't just give a dose if you have an abnormal finding. C, notify the charge nurse of the finding. Yes, but it's not going to be the first thing that you do. D, contact a provider for dose adjustment. Yes, absolutely. That's the second thing that you're going to do. The first thing you're going to do is A, is hold the dose, and then D, call the healthcare provider. So which of the following actions should you do first? Hold the dose. If you're unsure and you have an abnormal finding that you know is abnormal, the first thing that you're always going to do is hold the dose, and that is usually always the right answer. So let's go through one more question, all right? A patient in the clinic reports difficulty tolerating their current ACE inhibitor medication. The question and questions if another medication can be used. The nurse correctly suspects the prescriber will choose which medication which affects the renin-angiotensin-aldosterone system, or the RAS system. So this question has a lot of information in it already. It has ACE inhibitor, it has the renin-angiotensin-aldosterone system, the RAS system, um, and it has the patient's not tolerating it. So you know there's going to be a little tweak to the medication, and the medication that they're going to choose is going to affect the RAS system. Okay. Now, say you don't know what an ACE inhibitor is, but you know what the RAS system is, or vice versa. You don't know what the RAS system is, but you know what an ACE inhibitor is. Um, those two things, you're going to know something out of the question, even if it's just one part. And that one part will be able to guide you to at least getting to two answers that you can choose. So let's go through it. So the first answer is atenolol. So atenolol is a beta blocker, and an LOL. It's not an ACE inhibitor. So if we know that, if we know atenolol is a beta blocker, it's a very common beta blocker. Even if we don't know what atenolol is, we know that beta blockers end in LOL. This medication ends in LOL. So we know that it's a beta blocker. It's not an ACE inhibitor, and it doesn't affect the renin-angiotensin-aldosterone system. So we can kind of throw that away, because we know that it has nothing to do with the ACE inhibitors or the RAS systems, because those are in the kidneys, and beta blockers affect the heart and the blood vessels. The next one is losartan. So losartan is another one. Artan is the ACE and ARBs, and an ARTAN. If we know that, great, we can answer the question. That's the right answer. Losartan's the right answer. It affects the angiotensin, aldosterone system. But if you don't know that, let's put that aside and let's go to C, spironolactone. Spironolactone is a diuretic medication. All right. It does work in the kidneys just like the RAS system does, but it doesn't affect the RAS system. And if you know that it's just a diuretic medication, then you can kind of say, oh, well, it has nothing to do with ACE inhibitors and RAS system, so let's throw it out for now. And then D, adenosine. If you know what adenosine is, you know it's not the right answer. Adenosine is emergency medication that lowers, heart rate, emergently, and you're never going to give it in a clinic. So, knowing that this medication is never going to be given, especially in a clinic, and only in extreme emergencies, then that easily can be thrown out. So now we're left with losartan and spironolactone. They both work in the kidneys. They both help control blood pressure. So, now you're at a 50-50 chance, again, to get the right answer. If you know that losartan is, one of those ACE/ARBs medications and affects the RAS system, then boom, done, you know the answer. If you don't know, we did break it down. We were able to push the beta blocker out because we know that LOL is a beta blocker, and that beta blockers have nothing to do with the kidneys and are not going to affect the RAS system. And we know adenosine is this crazy emergency medication that we're never going to give in a clinic to a patient and go home with. So those are two question answers that we can easily eliminate. And now we have B and C that we can choose. Thank you guys so much. Please like and subscribe. This is one of many videos that I'm going to do on pharmacology, so please stay tuned.